and all the alumni and colleagues over here. As we all know, addiction is a disease. It's a brain relapsing disease. But today we'll be throwing more lights on what are the risk factors for substance drug use. Or we can say in a layman words, why a person becomes addicted. So let us first of all understand why people use drugs. There are many reasons why people use drugs. Some of the reasons, what we know, they use out of their curiosity. Friends are doing it, so chalo, let's we also do it. Mostly they do to feel better, to celebrate, to enjoy, and some also do to perform better or to feel better. Hence, these are the few reasons why people use drugs. But whatever the reasons may be, but no one ever plans to become addicted, right? So uh, there are a majority of the populations who experiment with drugs, but a very small proportions they progresses towards substance use disorders or become addicted. So we will be discussing the people are why the peoples get addicted. The vulnerability of addictions differ from person to person. However, overall, the risk of addiction it mostly relies on biological and environmental factors, and also the correlation between these two. So, as we understand these two factors, uh, when we talk about biological factors, which includes our genetics, predis- uh, the when we talk about biological factors, so there are mostly three variables: genetics, gender, and mental health illness. So, if a person or a parent, I will say the older person, the family member, or the parents who use psychoactive substances or have a history of drug addiction or substance use disorder, or they engage in criminal activity or having domestic violence at home, so the children's they develop a higher risk for falling into a substance use disorder or in addiction. Even we say कि men's when they go for sexual effects, for sexual pleasures, they take psychoactive drugs. They take drugs to perform very well in sexual activities for longer duration, and uh, continuation in this kind of activities make them more prone towards SUD, towards substance use addiction. Apart from this, there there are chances of the routes of administration when the person usage means how what is the routes of administration when somebody is taking uh, inject means if somebody is injecting drugs or smoking drugs, so the intensity of feeling high is felt within fraction of seconds, because smoking it hits your brain within the time frame of 7 seconds, 7 to 10 seconds. So the faster intensity makes them to use again and again for getting that instant effects in fraction of seconds. So they keep on trying this, and the chances become more vulnerable towards addiction. And when we say about Social and cultural practices. If uh, if social and cultural practices are discouraging the substance use, so the rate of addiction will be lower. Whereas if there will be the use of psychoactive substances is more in cultural practices for celebrating or using substance, uh, that will increase the rate of substance use addiction. That will tend to increase the rate of addiction. Even that will really increase the rate, and it will make people more prone towards SUD, that is substance use disorder. And when we talk about uh, peer, like friends, family, or peer group, they have a greater influence in the age of towards adolescence. If they introduce substance in if the substance is introduced by friends or peer pressures, so there are much more chances to use that, and it can result in SUD depending on the personality and the genetic makeup. Apart from this, lack of family support, social support, isolations are some of the factors which make person more vulnerable towards SUD. So when we get to know about all these consequences, pros and cons about developing SUD, about the risk factors of SUD. So if someone is really observing, or someone is really seeing people with that, so they should use the help of available resources and get the proper help with proper channel. Thank you.